reported 370 additional cases of COVID-19 in the state of Indiana, which brings to 32,437 the total number of Hoosiers known to have had COVID-19. We unfortunately also saw an additional 21 confirmed deaths. To date, 1,871 Hoosiers have died of COVID-19, and another 159 are believed to have died from this disease based on their clinical diagnosis. I want to emphasize that while these numbers are lower than what we've seen recently, and they likely reflect the fact, though, that we've had a long holiday weekend, which means that cases are still in the process of being reported. We should not get a false sense of security or assume that these numbers will remain low. It is far too soon to draw these conclusions. On a positive note, our ICU bed and ventilator capacity are holding steady, with more than 41% of our ICU beds and more than 81% of our ventilators still available. We've also seen 235,333 Hoosiers tested for COVID-19, up from nearly 184,000 just 1 week ago. More than 23,000 of these individuals have come through our statewide sites set up through Optum Serve. Of those, about 5% have tested positive, or 985 individuals, and 95% have tested negative, or nearly 19,000. We are still seeing many sites that have capacity to take people who need testing. So I continue to encourage Hoosiers to get tested. If you have symptoms, if you live with someone who has symptoms, if you're in a high-risk group, like based on your age, your race, your ethnicity, or underlying medical conditions, including pregnancy, or you need a test to go back to work. Visit coronavirus.in.gov to find a testing site near you. We're also starting the second phase of testing next week for the IU Fairbanks School of Public Health research study that will help us to better understand how COVID-19 is impacting our state and how many Hoosiers either have or have had COVID. This study has already shown us that the majority of cases in Indiana are the result of close household contact and not community spread. As a reminder, the first phase showed a 2.8% positivity rate, and 45% of those who tested positive were asymptomatic, which shows just how important it is to continue to practice social distancing. I want to emphasize that point because I saw reports from around Indiana and the rest of the country this weekend of people who were packed in pools or at restaurants shoulder to shoulder and without masks, not practicing social distancing. We do not want to see that number of cases spike because people got tired of these precautions and treated this kind of as an unofficial start to summer and business as usual. These are not business as usual times. The threat from COVID-19 is still very real, and we need to do all we can to prevent the spread of this disease. That may mean wearing a mask if you're at the pool and you're not in the water. It may be inconvenient, but I know that these steps can save lives. We will gain more insight into the impact of COVID during testing for phase 2 of the Fairbanks study. That study will run from June 3rd to the 7th at nearly 3 dozen sites around our state. Study participants were randomly selected and should be receiving a postcard. On the slide here shows you that postcard, a text, an email, or a phone call. If you get invited, please participate. Even if you've already been tested for COVID, we need you to take part in the study. This study is taking both nasopharyngeal swabs and serology so that we can determine if you have antibodies to COVID-19. This shows us if you've had it in the past, and it helps us to better understand how many Hoosiers who have had COVID but might never have had symptoms, or who wrote their symptoms off as simply being secondary to cold or allergy symptoms. We want to make sure that we have full representation of all Hoosiers, especially in our minority populations. We know that they have been disproportionately impacted by this disease. What we learn can help guide us, not just as we identify the safest ways to reopen the state, but also to help us learn more about how this disease impacts different populations across our state. Thank you.
Thank you, Dr. Box. Dr. Sullivan, you have some additional health updates, indicators, and some ramifications of everything that we're going through right now.
Absolutely. Thank you, Governor Holcomb, for the opportunity to put a spotlight on mental health needs and progress during the pandemic response. I'm going to cover some difficult realities we are facing today and in the future, and also remind Hoosiers of enhanced supports that are available for mental health and substance use disorder for the long haul. May has been Mental Health Awareness Month since 1949, and this year's theme was #4Mind4Body. This emphasis reminds us that our physical health and mental health are inextricably intertwined. To achieve well-being, we must attend to both on a personal, community, and system level. First of all, we are seeing data from our Medicaid health claims for the use of telehealth for mental health services. Between those claims and the reports from our mental health partners, we are seeing a remarkable increase in services being provided as compared to this time last year. We've been talking about the game changer that telehealth for mental health has been to provide support for individuals while they could not access services in a standard way. What we've learned in a short period of time is that individuals often prefer this modality, and mental health providers have found a place for telehealth in their clinical practice. Compared to the March-April timeframe of 2019, where 335 claims were submitted for mental health telehealth services for Medicaid, 21,964 claims came in for March and April of 2020. A brand new service with that kind of uptake is really unusual. In addition, the number of mental health visits by month is relatively unchanged compared to last year, meaning that individuals have had continuity of services, just in a different way. This indicates a few things. One, this is a needed service. Two, it is needed even more now. And three, access to mental health via this modality is decreasing barriers and improving access to care. Ongoing access to telehealth for mental health and substance use disorder is part of our Medicaid long-term strategy. That is true nationwide, not just in Indiana. Improved access to broadband and technology are just a few of our big projects to augment access and prevent disparities for those who may not have all the tools they need to receive ongoing support. We're grateful for the governor's Next Level Connections program and the partnerships that are needed to make this happen. Also, we've been keeping a very close eye on leading indicators for substance use disorder. April of 2020 saw the highest naloxone dispensation in Indiana ever, with 1,306 uses. We've never seen naloxone distribution like this before. The other statistic that jumped off the page at me was that 1.47, so almost 1.5% of all EMS runs year to date now involve deployment of naloxone. This is up from less than 1% for the same period in 2019. We know that naloxone is often the only tool that provides individuals with opiate use disorder another chance at recovery. We have not forgotten about these Hoosiers and the epidemic of substance use disorder that is one of our pillars. To help continue providing naloxone, we are providing $1 million of funding to Overdose Lifeline to provide naloxone kits directly to the public, individuals, syringe service programs, and recovery networks. Naloxone continues to be available to first responders through local health departments. Remember, naloxone is available through a statewide standing order provided by Dr. Box, and you can check where distribution occurs on optin.in.gov. I also want to remind Hoosiers that Open Beds is available. Open Beds is Indiana's system that helps us keep a real-time count of residential treatment openings for people with substance use disorder or struggling with significant mental health concerns. You can call 211 to access this service, have your medical provider make a referral through the online system, or a new feature, go to www.treatmentconnection.com. Nearly 600 referrals were made last month using this system. Open Beds launched in 2018 in partnership with Indiana's Drug Czar. Another indicator that we watch closely is the call volume and call content of our hotlines. This helps us to know where and when to shore up services. The data from our hotlines and also our 211 partner is daunting, but the stories are even more heartbreaking. One 211 supervisor shared this with me. People have always called us for help with basic needs like food and rent, but now they call us sobbing. We have always received calls from individuals impacted by domestic violence, but now we are talking to people while they are hiding in the bathroom with the abuser in another room. We have also seen a substantial increase in the number of people with mental health issues that were well managed or manageable prior to COVID-19. These aren't just crisis calls. They are calls from people experiencing trauma. They need someone to listen. People are scared. Our community's resources are taxed. Our community members' resiliency is taxed. We're proud to partner with our 211 team to help us understand what's happening in Indiana and how we can help even more. For just the first few weeks of May, we saw 57 domestic violence calls, 14 suicide and/or homicide calls, and made 732 referrals to a mental health service provider. Additionally, our partners at our domestic violence hotlines and 911 have reported extraordinary increases in the calls coming across the entire state. If you are experiencing any of these issues, you are not alone, and we have teams of people who are trained on how to help you. Please keep calling. We are here. One of our more significant undertakings was the development of BeWellIndiana.org. This is our state's new online home for mental health tips, resources, and connections. BeWellIndiana.org is designed to address the increase in anxiety, depression, and other mental health issues caused by the pandemic, including both first-time issues as well as pre-existing mental health concerns. This site features self-assessments you can use if you're not sure if you need professional help, and more than a dozen videos featuring personal tips from practicing Indiana clinicians and Hoosiers who have themselves faced and overcome mental health and substance use challenges. BeWellIndiana.org launched 1 month ago today, and so far has been visited more than 54,000 times with over 10,000 clicks on external resources. The most popular of those being the mental health assessments offered by Mental Health America. Hundreds of visitors also connected directly with Indiana 211 through the site, either by phone or text message. I'd like to spend just a minute talking about a challenging topic that has been a thematic priority for FSSA and our partner agencies: adverse childhood experiences, or ACEs. ACEs are a series of challenging events that accumulate over the first 18 years of a child's life that are scientifically shown to be connected to many long-term issues that go into adulthood. ACEs can affect everything from a person's development, behavior, long-term health, and even life expectancy. It is a list of 10 questions. Each yes equals 1 point. And after 4 points, outcomes for kids as adults have the potential to change their futures, sometimes dramatically. And we know that this pandemic is seriously affecting the life and well-being for many kids, and I've been thinking that perhaps "did you live through a pandemic" might become the 11th question. Prevention, recognition, and mitigation of ACEs are incredibly important right now. As we move into recovery and understanding that children, even in the best of circumstances, might have been going through a traumatic time is helpful for parents, caregivers, teachers, and really all adults that interact with kids. Because how we see things affects how we respond to them. If we see a child's problematic behavior as a result of them being a bad kid, we are likely to respond harshly, sometimes making the issue worse. If we see their behavior as a response to stress and understand that they don't have the tools yet to effectively manage the difficulty they are facing, we are more likely to teach, have patience, and respond effectively. Awareness of how this pandemic could affect families and children, and looking for signs of trauma, and then being a trusted, reliable source of comfort to kids is important now more than ever. What is the prescription for ACEs? It is resilience. Resilience is built on multiple levels: personal, community, and systemic. Building resilience is our antidote. This is what our post-pandemic society has to look like. Dr. Box and I talk about this all the time. One of the best prescriptions for resilience for a child is that they know that they have one person who is always there for them, no matter what. It can be a parent, a coach, a neighbor, a teacher, anyone. As we are charged with building resilient and trauma-informed communities and systems, we would ask you to be that person for our kids. I would also ask you to consider answering the ACEs questionnaire for yourself. About 61% of us have experienced at least one type of adverse childhood experience, and nearly 1 in 6 of us have experienced 4 or more. Answering the questions might help you understand your own responses to life, relationships, and this pandemic better. If you have an ACE score of 4 or higher and have experienced some problems in your life and relationships, the difficulties you've survived might be at the root of these issues. You are not broken. Connecting with a counselor can help. Additionally, understanding ACEs might help you offer some more grace to your fellow Hoosiers in our new normal. I think of it like this. In our current structure, we assume everyone has an ACE score of 0, and we react accordingly to others' behavior. What if we just assumed that everyone was carrying a little bit of trauma and we all had an ACE score of 8? It might make us change our mind in how we behave. You can find the ACE assessment tool through multiple sources, including joiningforcesforchildren.org. And with that, I'm excited to introduce our guest today, Dr. Ukamaka Oruche. Dr. Oruche is an associate professor at the Indiana University School of Nursing and has worked for over 20 years as a nurse practitioner at Eskenazi Health, specializing in the mental health needs of children. She is going to give some additional advice for adults who are watching over kids' mental health right now and as we head into the summer. Thank you so much for joining us today, and welcome, Dr. Oruche.
Thank you so much, Dr. Sullivan. Thank you, Governor Holcomb, and thank you, Dr. Bax. And I want to echo all of what you have said in sharing this advice. First, that COVID pandemic, the coronavirus pandemic, is a traumatic event. An event is traumatic when it threatens us or someone that we depend on for safety and love. And we have all been affected, especially our children. So expect that children will express their emotions in different ways. Some may act out or become physically aggressive. Some children may show depressed or sad mood. And children's expressions of all of these emotions can occur at different times. They will resolve or worsen over time. And in some cases, you don't even see those expressions for a good 3 to 6 months, way past the event. And in addition to the pandemic and various stay-at-home orders, many children and their families have experienced added stressors. For example, parents losing a job, additional financial stressors, and the need to depend or rely on food pantries. Lots of family members are not having the opportunity to say goodbye, offer a proper burial, or to grieve properly. Also, a lot of typical outlets for stress relief, connection with peers, schoolmates, teachers with school closings. And although children are incredibly resilient, still need our help and care. And to Dr. Sullivan's point, supportive, caring adults can help children recover from trauma and enhance resilience. So whether it's at home, in daycare, or summer camps, check in with the kids often and help them to identify their emotions. Let them know you are there for them. Allow them to talk freely and provide reassurance, and encourage healthy habits, social distancing, good hygiene. You want to describe the relevance and benefits of all this so that it reassures the child and not amp up the anxieties or fears. Maintain a routine for the children so they know what to expect, and designate a safe place where they can retreat for quiet time. We can call it the stress-free zone. You want to be patient and absolutely offer praise and grace. Here are some steps too, particularly for parents who still may be working from home, supporting their children through e-learning for those who have to do summer school. Please continue to be patient with your children, provide a structured daily routine for them and for you, and work together with them to develop the schedule, and definitely continue to minimize time spent watching TV. Building playtime, like activities in the yard, taking walks, going to the park. You want to speak with your children honestly, but consider their developmental age. And we want to emphasize how each of us let the children know what they're doing, social distancing, maintaining social distancing, keeping good hygiene not only helps them, but other people. And I want to remind you as caregivers that it's normal to feel frustrated and overwhelmed. Please take care of yourselves as well. And how do you know when your child now needs actual formal or professional mental health? If you see the symptoms persist and begin to affect your child's day-to-day functioning, their interaction with you, peers, and other people, then it's time to seek some professional help. In general, we start with supportive counseling, and if needed, we may add medication from a licensed professional. And if you or your child needs help, please call 211 to get connected with a mental health provider. Thank you so much.
Thank you so much. Thank you, Governor, for continuing to highlight the need for mental health supports as an integral part of our response. We're really proud of this work, and we will double down on our efforts to keep Hoosiers healthy and safe. Thanks.
Well, right back at you. We're proud of both of you and what your teams are doing on a day in and day out basis. I will tell you, when I came into the office this morning, I had this t-shirt waiting for me. It says Resilient Madison, the city Madison. And I would have given it to you because you talked about resilience had I reviewed your comments and I'd known, but so much of what you both said is not just important, but again, it resonates. And I think it's important for us to not just recall, but to truly understand that those words in this together are not rhetorical. This is a playbook in this together, and you never know who you're going to have a positive impact on or direct to the right line or website. And what you said, "we are here," kind of sums it up in 3 words, one sentence. We are here, we do care, this is what you do. And it's not, unfortunately, the first time you've seen these cases. So I would hope that if anyone has these type of thoughts on their mind, that they would reach out to us. It will mean the world to us that you want to work together on this. So please, please, please call. The folks at FSSA, at the Department of Health, at the county level, at the municipal level, have really reprioritized what we're doing to get at these downstream effects, the ramifications, and it works. And so if you have some of these thoughts, please do reach out. My spirit is constantly, daily renewed and energized, quite frankly, by these countless good acts and kindness and creativity. There's the one example I want to get to before we go right to the Q&A, couple actually. One is in Rush County, Indiana. The Rush County ECDC and the Rush County, Rushville Chamber of Commerce came together and created a program that's making a big difference on Main Street, Indiana, or Main Street, Rushville, Main Street, Rush County. Yesterday, they initiated a program where people bought gift cards for $30, a value of $30, and they paid $20. The Rush County locally owned businesses where you could use these cards. So they raised about $20,000 privately to provide that $10 gap, and then you went into a local store, got $30 worth of goods. The business was reimbursed for $30, but it only cost $20. So these are those creative approaches to make sure that we're revitalizing or renewing our communities at the very street level. They started that program at, I was told at last night late, about 9 a.m. yesterday, and they sold out that first phase at lunch. So 12:30 they were through with about $60,000 worth of gift cards that were going to be used on Main Street. And that's just yet another example across the state of Indiana where in this together is the bottom line. And so I want to say thank you not just to those county leaders and city leaders over in Rush County, but also earlier this year, it feels like years ago, but it was literally just maybe a couple months ago, I signed an executive order to form a healthcare reserve workforce that allowed students to be placed in healthcare facilities. Doctors in medical school could graduate early. Healthcare professionals who were no longer working could get reconnected. And it proved to be a wild success, huge success. And now we've got, you mentioned last week, I think over 10,000 healthcare professionals and students have been matched with these Indiana health facilities all throughout the state of Indiana. And when the call went out for that reserve workforce, we also asked for those facilities for what their needs were. This is how we were informed. And the data that we were collecting, we wanted to not just marshal a workforce, but actually direct it to where those actual needs were. We heard from more than 100 facilities that asked for help. Most were long-term care facilities and service providers and folks who could help with individuals with disabilities, et cetera. So really across the board, across the state, border to border. And we have just a quick look at some of the progress and the status of that whole effort that we're going to play for you now, and then Rachel will go right to Q&A from that.
The reason a lot of us go into this field is to serve others, and the need to serve our communities is greater than ever.
We're all a team, we're all there together, and we all kind of understand the risks of what we're doing and the benefits of being able to help that community.
Very closely with the governor's office. When he issued that executive order, about a third of our medical students actually decided to graduate early, and then many of them found positions in healthcare systems around the state to help out on the front lines.
Emails went out early in April, and we had a number of hospitals respond. We were able to connect every single hospital that requested or had need for new physicians, was able to have them.
That's been enormously beneficial to us. Being with medical students and young doctors is always invigorating, and particularly in a time like this where sometimes I feel like I've seen everything before, nobody has seen this.
Our students worked in a variety of settings. Some of them worked in emergency departments, some in palliative care. I know our students are tremendously grateful to have opportunities to do things like visit people in nursing homes or in homeless shelters and help keep them safe as well.
These are people who are unlikely to come in contact with medical care regularly anyway. So we would want to be able to offer those services to them. I don't want them to have to fly under the radar, get sick, and then spread it around the community.
The call went out. They responded. They knew there was a problem. They ran at it. They didn't run away.
It's no longer am I taking from the community as a student, but I'm now giving back to my community as a licensed professional.
I'm very proud. I think it's an amazing show of what we're capable of, but also what we want to do.
I'm tremendously proud of our students and how dedicated they are, and I am very eager to see all the different ways they're going to serve people in Indiana and beyond.
All right, Rachel.
Erica Irish, the State House File.
Good afternoon, Erica.
Erica, you should be able to speak. We'll circle back. Meredith, WLFI.
Good afternoon, Meredith.
Good afternoon. I hope you guys are doing well. So I have a question when it comes to opening schools. Now, have you guys kind of made any decisions to that? And if you have, will there be like a similar style of reopening gradually in phases? And could that be like county-based?
Well, all the above, kind of, but no, we have not made a decision. Katie, you want to give us an update on the discussions, how they're going? We're in constant conversation with the Department of Education and schools around the state. That's probably a couple weeks off, but you might give the latest update.
Sure. Hi, I'm Katie Jenner, Senior Education Advisor for Governor Holcomb. And this question that you asked is certainly top of mind for us and top of mind for educational leaders, parents as well. We are hard at work with the Department of Education and the State Department of Health, a couple of doctors here at the table whom have provided many hours thinking through this as we work on comprehensive reentry guidance for schools. We understand the importance of the timely guidance while also balancing the necessity to review the most updated data and research on how to maximize our student learning while also ensuring safety is the priority. We will provide this reentry guidance, as Governor Holcomb mentioned, just as soon as possible. And thank you for the question.
Brandon Smith, Indiana Public Broadcasting.
Good afternoon, Brandon.
Good afternoon, Governor. This question is for Dr. Sullivan. You have the new program that allows people to use their SNAP benefits to access grocery deliveries, but I'm hearing from folks who simply cannot find stores who are willing to do that. So what is the state doing to ensure that this new program, which it has been touting, understandably, is actually available for people?
Thanks so much for the question. So testing goes live for SNAP delivery beginning of next week. We have 2 assigned partners currently, and we'll work very quickly to bring more on board as that program grows. We already have curbside pickup available across most parts of the state, but are working very diligently to make sure that we have onboarded stores for SNAP delivery programs. So more to come. And again, SNAP delivery will be a permanent feature of SNAP in Indiana, not just part of the pandemic.
Rob Burgess.
Hold it. Oh. Brandon, you want to follow up with a question?
Yeah, sorry, just really quickly, which are the 2 partners that you've already joined with?
We have letters of intent and from Amazon and from Walmart.
Thank you.
Thanks.
Thanks, Brandon. And you said?
Rob Burgess.
Rob.
The Wabash Plain Dealer.
Good afternoon, Rob.
Afternoon, Governor. Good to be with you again.
You as well.
I had two questions. First for Dr. Box. I wanted to return to the multi-system inflammatory syndrome in children you mentioned last time. When he was young, my brother was actually treated at Riley for Kawasaki's disease, so I have some familiarity with it. I remember it being exceedingly rare and a mysterious disease, and only a couple dozen people in the world would get it a year. What, if any, connections can you tell us about that thus far? And then do you have an updated number? I know you mentioned the first case, but if you have any updated numbers on that. And then I had one for Dr. Sullivan, but if you wanted to go ahead and answer that.
Rob, that's interesting that your brother had that, and I'm sure that was a very scary time for your family and for your brother. The 2 diseases, or the 2 syndromes, are very, very similar. There are some distinct differences, and that's how, as we do these case investigations, we can look into that and be able to determine which is which. We still are investigating cases and looking at cases that are presented to us, mostly from our children's hospitals here in the state. To date, we still only have 1 case. I do think with looking at some of the cases we have now, that number may go up a little bit.
Okay, and then Dr. Sullivan, I remember recently you had a discussion regarding people experiencing homelessness, and I know the point in time count was conducted in January. Did the pandemic cause any delays in gathering data from this year's count? And might it be worth it to do another such count at this time, given maybe not waiting for next January, given the disruptions of the past few weeks and months?
The question and the suggestion are both valid. There was not a delay in collecting data, but we do think that the spotlight on the plight of homelessness is really important, especially now, and the increased attention for housing as a social determinant of health and an unmet need. I do agree that looking and making sure that we are keeping on top of our numbers and our programs is really important. So talking with our homeless coalitions about point-in-time counts is a really, really excellent suggestion.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. Good afternoon, Dr. Box. Good afternoon, Dr. Sullivan. Governor, this one is for you, oddly enough, today. Washington State recently had a major data breach with their Department of Workforce Development. Millions of dollars believed gone, lost, missing. Anything of that nature here in Indiana with our Department of Workforce Development?
No, Fred's making his way up here. Update me, please, Fred, and 6.7 million Hoosiers out there as well, if I have that wrong. However, I will say, Abdul, you bring up a good point about making sure that the tax dollars that are allocated for certain purposes are getting to the individuals that they're intended to get to. and that we haven't been compromised or hacked, so to speak. Fred, you want to talk about how sometimes that is built into the manual process of verification, making sure that tax dollars are going to those folks who are actually legit.
Sure. And we are aware of the data breach over in Washington. And as the governor said, we do have built in our system what we call integrity in our process. Part of our manual process and our auto adjudication process, it actually adjudicates out some of the fraud that could be in place if we didn't have those particular measures there, like our 2-week waiting period, or better yet, our protest period. That period includes a manual process of our agency checking with an employer to verify the employment data that an individual has provided. Those measures and others help us to prevent fraud. We had a very good rating back in 2019 with integrity with the Department of Labor. We were rated as number 2 in the nation for a large category. So we do have measures in place to address fraud before it takes place.
And you also, Fred, you want to just comment on the new federal standards that came with the new dollars that
Yes.
we had to get up to speed on very quickly before that dollar went out the door?
Right. Very good point, Governor. One of the things that, as you may recall, when we were setting up our new systems for PUA, PUC, and PUC, all of these new systems that we put in place, we had to put them in place very quickly. But the U.S. Department of Labor made it very clear to us that as we're putting those processes in place, we cannot take any shortcuts on integrity, meaning that we cannot take any shortcuts on preventing fraud in our process, which is why in some instances we cannot speed up a process, because we have to make sure that we have integrity in each one of those steps along the way to ensure that we are paying the right person at the right time.
Thank you, Fred.
Nikki Kelly, the Fort Wayne Journal-Gazette.
Good afternoon, Nikki.
Good afternoon. About 7 weeks ago, you established the Relief and Recovery Team, and in that time period, other states are using their federal dollars for things like rent assistance, business loans, broadband expansion. So can you give us some examples of what the state plans to use its $2 billion in CARES money for?
Yeah, Chris, you want to actually, you could spend an hour on this, but you want to kind of start with the actual $5 billion that came into the state, down to the 2.4, down to the 1.5, down to the, and just give a kind of an overview, and then we can follow up with Nikki.
Okay.
On some of those examples, and not the dollars that were directed to hospitals or to, with the strings attached, but the dollars that I think Nikki is asking about that came into, passed through the state of Indiana.
That's right. Well, out of that, as you mentioned, there's Chris Johnston, Director of Office of Management and Budget. As the governor mentioned, approximately $5 billion has been awarded to the state of Indiana, but really about $3.5 billion of it passes through state government. And so that ranges, it touches on education, economic development programs such as the Community Development Block Grant, transportation or transit programs. But the one that I think, Nikki, that you're referring to is the Coronavirus Relief Fund. That amount is about $2.4 billion. A couple of weeks ago, the governor announced that $300 million of that would be allocated to local units of government to use for their fight against the COVID-19. Other programs that we're using it for, and again, there's tight restrictions on the use of that money. It has to be direct expenditures of public health and medical expenses. It has to be for expenses that weren't in your current budget, and it's only for expenses between March and December of this year. And so some of the other programs that we're looking at are assistance to staffing at the Department of Correction in coordination with the Indiana National Guard, recovering those costs for those services. And I think later, or in the near future, the governor is going to be announcing a small business program that'll help bridge the expenses. We've talked about the, I always get the PPP, the Paycheck Protection Program that this SBA has made loans to about over 70,000 small businesses in Indiana to the tune of about $9.5 billion. This program we're going to look at is going to be complementary to that for some businesses that have not been able to take advantage of those federal programs.
And I would just, Nikki, I'll confess, I'm a little bit sensitive to your question because you mentioned specifically internet connection, and you'll recall Indiana is far and away ahead of most every other state in terms of state dollars that we're devoting to internet connections throughout the whole state of Indiana, especially rural Indiana. We've allocated about $30 million to date. We got about $70 million to go at this next round that we'll award. The applications are already in, and we'll make those awards in July. But that $70 million sitting there right now to do just that. In addition to that, in terms of e-learning, we have made, you might want to just touch on the $61 million to the federal government that we've made an application for on that as well.
Okay. There was part of the education allocations is the Governor's Emergency Education Relief Fund. And the focus on that really is remote learning for the primarily K through 12 school corporations. And so looking at that as far as access to devices, access to connectivity, and then also looking at the training for teachers so that we actually have very effective remote learning.
Thank you.
Sheila, WLKI.
Good afternoon, Sheila.
Good afternoon, Governor. How are you today?
Very good, thank you. Yourself?
I am wonderful. It's a great day here in Northeast Indiana. Dr. Sullivan led us into a discussion about adverse childhood and family experiences from added stresses as a result of how COVID-19 has changed our society. And certainly educators have sensed these issues with their students during weekly check-ins during the remote learning process. What kinds of things, perhaps even training or funding, is your team looking at to better equip educators and schools with all of these changes in our society that have affected our Hoosier youth?
Katie, you want to take that and I'll clean up if need be?
Hello again, Katie Jenner, Senior Education Advisor for Governor Holcomb. And your question was perfect timing with Chris Johnson going right before me as he spoke about the Governor's Emergency Education Fund. And one of the pieces he mentioned is educator training. And I think that without a doubt includes some of the pieces that you're mentioning with regard to how can we improve remote learning in our state. And it's the whole package, as we've discussed. Academics also includes the social and emotional piece. And again, there will be more information to come soon about the application process, but thank you for your question and perfect timing.
I'll also add that across both FSSA and ISDH, the attention to adverse childhood experiences is not new. It is certainly amplified currently, but there are multiple partnerships on looking for how we might screen for ACEs more effectively across the state, both in healthcare settings and educational settings. And Dr. Box is working closely with some of her partners, if you want to talk about that for a moment.
So we have several grant programs across the state where we're actually embedded with the schools and helping schools not only to be screening for adverse childhood experiences, but as you recognize them, training that resilience in children so that we can help them to better understand why they respond in certain ways and to address those things that we know have an overlying effect on the way they respond to things and can really inhibit their ability to come to school and be ready to learn every day. So we've had multiple sites across the state already and are applying with the Indiana Academy of Pediatricians here to do more grants and more studies with regards to this.
Yeah, and I'll just say, I don't want to be left out here. So I'll just say that, Sheila, that this is why it's important, and Katie alluded to this, that we're working with schools, with the Department of Education, because we do recognize it's about the students and the teachers, it's about everyone that goes into that building. And we want to make sure that when we do reopen, it's safe. And I've been impressed with all the information that we've seen in K through 12, or for that matter in our colleges and our universities, our world-class universities. Now, I'm not surprised that a few of our presidents have been recognized nationally for putting very thorough and thoughtful plans in place that consider the student experience and consider the faculty, the teacher experience, both. We are approaching this as how can we, not how can we not. And I'm convinced that we will be able to reopen safely, and it won't be hodgepodge, but there won't be one size fits all. This will be informed from the very local level through the Department of Education and our administration to open safely.
Erica Irish, the State House file.
Back to Erica, where we began.
Good afternoon. Can you guys hear me?
Yes.
Perfect. Thank you. I have two questions today. The first to all three of you. This morning, Indianapolis Mayor Joe Hogsett and Marion County Health Commissioner Dr. Virginia Kane announced they're going to start a program to offer free masks to Marion County residents. Would the state consider offering a similar initiative statewide to promote mask wearing? And my second question is specifically to Governor Holcomb. This weekend we saw protests at the Indiana War Memorial regarding the reopening plan. This criticism isn't anything new, but do you have anything to say to claims made by those protesters that the state needs to reopen immediately with no restrictions? Thank you.
You want to take the first question first? And
Sure.
You probably want to take the second.
I'll leave the
too,
easy
but I'll
one
take the
for
second.
you. The question about masks is excellent, and it's been interesting, but I have heard from several small businesses and individuals across the state that they had reached out. In fact, family was here over the weekend and said, oh yeah, we got our masks through the, buying platform here at the state, and it really meant a lot to them to be able to do that. I think that we may need to look ahead at schools and other places where it may be difficult for schools to get masks and work with them to try to provide that. I think that really it doesn't have to be a surgical grade mask. What we're talking about is some type of a face covering. So people can get very ingenious when it comes to that. And these individuals that are making masks, really I encourage you to continue to do those and to pass them out to your neighbors and your friends. You can wear a scarf. There's a lot of different ways to approach this.
Yeah, and I would just, Erica, say that I continue to appeal to individuals' commitment to the public good and their place in it, their role in it. We're all, like it or not, interconnected. We're all going to sail through this pandemic or storm together. And I understand, in fact, I respect folks who have a different opinion, but we're going to continue to keep our head down and look at the data and let that guide us through this. Some folks are full steam ahead, damn the torpedoes, but I can tell you when the torpedo strikes and it hits, it takes people down. This is a silent spread, and it can silently kill. And we have to understand that folks can be asymptomatic and not know that they're passing this on, not intentionally, for sure. But when you get into those confined, large gathering areas, that's where we tend to see the spread occur. And so I would just ask, I've got thick skin. I sleep well at night, live with the consequences of the decisions that we make. But I would just continue to appeal to folks' sense of civic duty, not just their personal responsibility, but how their liberty can impact someone else's. And that's the bottom line with us here. We're trying to get through this as safe and swift as possible. And we're a state that's done, dare I say, a pretty good job at keeping the balance. There were some states, understandably, and again, there's no one size fits all. There are some states that completely shut down. There are some states that completely didn't shut down. So be it. They made those decisions. We looked at the information before us on an hourly basis, not just a daily basis, but an hourly basis. And that's what informs us. And we'll get through this safely just as soon as the data directs us to.
Steve with KPC Media.
Good afternoon, Steve.
Good afternoon. How are you doing today?
Doing good. Thank you. Yourself?
Pretty good, pretty good. Two questions, both from readers and members of the community today. The first one, I got a call from a guy who was just having an impossible time finding things like wipes and hand sanitizers and wanted to know, are there any kind of state resources for private citizens to get on that? I know there's a small business marketplace, but that's not generally open to the public. Second question was about nursing home response. We had a nursing home just get its first case. And there were some questions about what the state's strike team response is to that, if there's kind of a standard response. This person was saying that they didn't feel like there was a whole lot of testing or anything taking place after this first. So I didn't know if there was kind of a standard operating procedure, or if I could just get a reminder on how those strike teams respond when they go into a new nursing home that's got its first signs of infection.
Thank you, Steve. Dr. Dan's going to take the second question, I think, not the first.
Happy to. Dan Rosiniak, Chief Medical Officer, FSSA. So in general, the way it happens is they'll reach out first to our strike team because they've got a resident or a staff who's got symptoms. So first thing is to determine whether those symptoms are actually COVID-19. So the strike team will go in and will actually do, in most of the cases, the sample collection. So that is a level of intensity in terms and training that's a little different than what we'll do in follow-up. So folks come in who know how to do the appropriate sample collection, and then we send those right back to our labs. That way we get fairly quick turnaround time, usually less than 24 hours. If we find out indeed that there is a case of COVID in a long-term care facility, then we follow up with we call them our COVID Plus team, and what they'll do is they'll come work with the facility, figure out how many residents are in that area, or if it's a staff, how many residents that staff may have potentially interacted with. Then we figure out how many tests are required to test all of those folks who might have been exposed, and then usually we'll facilitate the testing by coming up, dropping off the test, helping them with the logistics of both linking an individual in that facility to the test result using some technology, and then also serve as a shuttle to get those tests back to the lab. And then we actually report back on all of those labs individually. So we'll call the facilities, let them know who resident-wise has COVID in the facility. We then have additional teams that work, infection preventionists and our nurse surveyors, who will work really closely, often in person with that facility to say, okay, based on the way your facility layout is and those who have COVID and those who we now know don't, this is the best and the safest way to separate, or what we would call cohort them. So the whole process can take really 3 days or so to get all of that testing done, but it's really thoughtful and it's done in a way to try to reduce outbreaks along the way.
Thank you, Dr. Dan. Chris, you just want to address how, to Steve's first question, how we're allocating or sending dollars to local communities, but municipalities or counties, how they're applying, how that then shakes out to the local community where these needs can be met on a local, community by community basis.
One of the things I mentioned in the last question, in the response to my last question, was the $300 million. Those funds were allocated to Indiana counties, cities, and towns. And they follow the same appropriate uses that the state government does. And part of that is the personal protective equipment. And so to the extent that the community has decided to not only cover their first responders and other needs that of that local government, to the extent that there are businesses that need PPE, sanitizing materials, other supplies, that's an eligible use that they can submit up through the local unit of government, who then submits that to the Indiana Finance Authority and can get reimbursed for those costs.
Perfect, thank you.
Lindsay Erdody, the Indianapolis Business Journal.
Good afternoon, Lindsay.
Good afternoon, Governor. With President Trump threatening to move the Republican National Convention from North Carolina and several other governors from other states saying their state would be open for it, are you or would you offer Indiana as an option? And second question is, wondering if you can provide an update on the work from the enforcement team, how many complaints, verbal warnings, cease and desist letters, et cetera, and if possible, if there's any indication there was a spike in that over the holiday weekend.
Lindsay, you just got Joe Herons to snap to attention. That's impressive. Joe, you want to take that one, and then I'll come back to, or while you're walking up, this will be quick. Lindsay, I'll tell you, I did see the reports of the president asking for clarification and guidance from the governor of North Carolina as they ramp up for the national convention. I love a party just as much as everybody else, but maybe you've heard we got this little race coming in August, I hope, and that would, I think, conflict with the timing of a major national convention. So if asked, we'll respond, but we haven't been.
Joe Herons, General Counsel to the Governor. The numbers I have on the investigation are aggregate numbers, and the most recent ones I have are from May 19th, and this goes back to the start of enforcement approximately 2 months ago. But the number of complaints that have been investigated as of May 19th, 1,660. The number of complaints that were unfounded or without merit, 1,426. The number of verbal warnings that have been issued, 146. And the number of cease and desist letters is just 1 at this point. So that's where the enforcement team stands as of about a week ago.
So, Lindsay, Joe will have an update on Friday.
Our final question is from Aaliyah with Wish TV.
Good afternoon. Thanks for joining us.
Good afternoon. I have 2 questions. Dr. Sullivan, you talked about adverse childhood experiences. Would you know how many children or a percentage of children that are experiencing this, since it's been amplified since the pandemic? And also for Dr. Box, you talked about the numbers, how we are seeing a decrease and things are beginning to reopen here in Indiana. Is there a possibility that we could see a second wave?
I'll take the first question. Thank you. We don't have a systemic mechanism for screening for adverse childhood experiences currently. It's one of the big projects that Dr. Box and I have a shared passion to implement here in our whatever time we have left in these roles, to make sure that we have a baseline and then can respond to increases that we see, not only at the individual level, but also on the systemic level, because that's where resilience happens, is both of those places. So I don't have a good answer for you in Indiana, but I do know that back in the fall, the CDC issued a really monumental morbidity and mortality weekly report, and gave a new toolkit that gave some pretty incredible detail around ACEs and their effects on health across the United States after a decade of study. And the numbers were pretty alarming then, those numbers that I reported earlier of nearly 1 in 6 adults having experienced 4 or more adverse childhood experiences up until age 18. I don't think those numbers are going down right now. And so I think, again, our assumption isn't necessarily to screen everyone for those, but to assume that people have trauma that they're carrying with them today, and to build a system that responds accordingly to support them through that. Our goal is that your number, your ACE score, does not predict your future. It shouldn't be your fate, but that our systems respond to individuals so that despite those things, or mitigating going from a 3 to a 4 over that period of time, is the way that our society revolves around individuals and around children, so that we can all live our healthiest and happiest lives.
And briefly, Ilya, I'll just say that, yes, I'm cautiously optimistic about the numbers that I've seen. I want to see several more days of that. Could we have a second wave? Absolutely. It's going to depend on the individual responsibility that Hoosiers all over this state take to making sure that we continue to socially distance, that we continue to use good hygiene, and that we continue to wear masks so that we can protect those around us. And that will really make the difference in the long run.
You want to just elaborate on the lag from activity, behavior, and
so for instance, if we make a phase change, when we've looked at this data-wise, it takes another 5 to 7 days before we see people really start to participate in that new level of activity and to get back into the restaurants and do some of those things that we have loosened up a little bit. And then if you add on top of that, you get exposed, and it may take another 5 to 7 days before you show symptoms or truly have any risk of infecting people, then an even more prolonged time, 10 days or so, before you might be sick enough that you would need to be in the hospital. So there really is a significant lag that can occur, and that's why we continue to look at the numbers, and that's why we caution as we talk about going from one phase to the next. It's not an automatic set date that we definitely go from phase 3 to phase 4 on this date and phase 4 to phase 5 on this date.
And yet, you're highly contagious when you're not showing symptoms.
That can happen for sure.
Thank you for joining today's briefing.
All right, you've been listening to Governor Eric Holcomb and state officials updating us on the coronavirus pandemic across our state. Probably the biggest nugget to come out of that there is no word yet on when and if schools will reopen for next school year. We'll have much more on what the governor had to say coming up at 5 and 6. Mike and Anessa will be back with you for All Indiana